morning, everybody. Welcome to Skill Days, Urgent Care Dublin. Today, we're gonna learn how to do finger traps. Hello, everybody. Today, we're gonna teach how to do finger trap. This patient here is being confirmed by the doctor on X-ray that she has a fractured wrist. The first thing I'm gonna do is I'm gonna use our stocking net. All right. I'm gonna go ahead and put this right here, finger right here. I'm gonna try to do as much, have some extra, that way we have enough to fold. Once I come here, I'm going to make a hole in there. Allow the patient to bring her thumb in here. Once I do that, I'm going to fold this right here. Once you fold this right here, the doctor is gonna come and inject lidocaine in this area right here and do some movements. So what I'm gonna do is I'm gonna open the hole in here, make a nice hole here, make sure that there's enough room there for the doctor to work.
Ms. Nympha has a distal radius fracture that is displaced and angulated that needs reduction. So we are going to discuss the steps from a provider standpoint, or what needs to be done to, the steps needed to get the fracture reduced and placed in a finger trap and ultimately put into a splint for discharge. So once we've identified the fracture on the x-ray and that it needs reduction, I would need a anesthesia so we can perform a hematoma block. The hematoma block would be, the tools we would need for that would be 1% lidocaine plain, your 10 ml syringe and a 27 gauge needle, and alcohol swabs. So when this is brought to me or to the bedside, I would then inject the appropriate amount of medication. There was usually a hematoma in the area of this type of fracture, so it would usually be swollen. So I would then, drop my medication, clean the area, and inject in the hematoma the lidocaine to provide enough anesthesia to attempt the reduction. Oral medication can also be used if needed, in addition to the block. Once the patient has her hematoma block, I then would call on my ER tech to place the patient in the finger traps. So typically, the patient would be now numbed, and we'd place her in this position to then have the finger traps placed. Okay, so she would be placed in that. The tech would then have to adjust the tension on this to provide adequate tension to allow the muscles, this allows the muscles to relax to help the reduction go in easier. So not only is she placed in the correct position in the finger traps, but the muscles will relax and it will make the reduction much easier. Once the finger traps are placed, typically around 20 minutes or so, then the provider usually would return with the tech to apply the splint, which is usually a sugar tong, with, at times, and it depends on the fracture, some manual reduction and some movement here on the distal radius to get that fracture piece aligned. So this, in my practice, I would usually apply some pressure on the angulated distal fracture segment here, with holding the wrist in the right position while together with the tech applying the splint.
So the best way to do this, I find it easy, find the right size, do it in this position. All right, put the finger there, push it in, all the way in, and then pull. Push it all the way. Pull it all, yeah, it's gonna be tight.
Yeah.
It is gonna be tight. Push it all the way in, and pull up. The next one, finding the right side, it's gonna be a key, right? Then come all the way over here, same again, hold it here and push, pull up. Same thing over here, all the way in, hold it to the base and pull up. Then I gotta see which ones I have. I'm gonna do this one here, same thing, pull up, got one more, pull up.
Yes.
All right.
Yep.
It's easy if you do the finger straps in this position. Doing the finger strap from here, it's gonna be too hard for you guys because you have the patient is sitting right here on this, which is called the arm of the chair, and it's easy. You have better control right here. Once you're in this position right here, then you wanna come back over here and adjust the high, the bottom. And if you look over here, the legs are longer over here, and these are the shorter. All right, so figure out where you are right now. If you're on a bed, if you're on a chair, the best way to do is using the short legs.
The shorter legs is facing the
If you
patient.
use the longer legs, you'll be way too far,
Yeah,
right?
okay.
You want to get closer. So short legs over here, right there. All right. The next thing you're gonna do is you're gonna have to, before you even hang the patient, don't try to hang the patient while you're adjusting this. All right. You're gonna open this up, put it as high as you can, right there. All right. Sometimes you're gonna have to adjust this too. Move it around, the same thing. You open this up, either lower and higher, depending, like I said, if you're in a chair or you're on a bed. And then make sure it's nice and tight. Fingers. All right. We already adjust this. All right. We're gonna have the patient put the bed down or chair, because the more flat they are, the better. Sitting up is gonna be too difficult to use the finger traps. All right. So what I'm gonna do is most of our chairs and beds you can move this and put it on the side. So that way you want to have the arm.
Okay, I'm gonna help.
And she's gonna help me right there. I'll ask the patient to help me. I'm gonna bring my finger traps. I can either go right here. Remember, this piece right here can move here or here. Okay? So depending where you are and depending what you're using. So for this particular one, I'm gonna put it right here. And I'm gonna have her hold it. I'm gonna use the rope. Don't use this. It's safe if you use the rope, because this might come out. This one more here. Got two more. Okay. Once we're here, I'm gonna have the patient just relax, let it drop. If you notice the position right here, this is how you want it. This is perfect right here. Once we do that, this is what I was gonna tell you. I can always adjust this part right here. Let me just kind of move it right here for a little bit. Right there. What I'm gonna do is once I come to this part right here, I'm gonna put this piece right here. I'm gonna connect this. The way you control to crack it, to move it forward or backwards, there's a switch over here. I can go forward or back, depending which way you're going. All right, so I'm gonna go forward. Okay, so I'm gonna explain to the patient that I'm gonna put some traction right here. I'm gonna remind her to just let it hang, just relax. I'm gonna start really slow. The thing I'll tell you is about safety. Make sure that brakes are all on 4 wheels, because otherwise it's gonna be moving around once you start putting the pressure. Once you're right here, I'm gonna put some traction here. I'm gonna communicate with my patient, how she's doing, how she's feeling, is it hurt too much? right there. If she tells me that it's too much pain, then I'm gonna stop. I'm gonna go talk to my doctor, and I'm gonna have my doctor be here to tell me how much pressure does the provider wants. Typically they want 10, which is like 10 pounds. But right now, see, I'm still not even in 5 right now. But because I'm scared to put too much pressure, so you have to be very careful on right here. If I were you, I'll bring the provider and have the provider do it. This is the position we want the patient. If you notice, once I put the fiberglass, this part is gonna be open. This is what we're gonna use on this. All right, so she's not exposed to the fiberglass. I'm gonna go right here, just on the area that I opened earlier today. Boom. Once I do that, I'm gonna come over here and I'm gonna try to measure how much fiberglass I need. Boom. I understand some of you guys don't put water on the fiberglass because you need more time to work. But when you're doing any type of finger traps, you gotta put some water on. Because what we want is for the fiberglass to get firm fast. All right, once I do that, doctor's gonna come, put in comments how long, 15, 20 minutes. And ask the doctor first how long, you know, keep track of the time. Keep coming back and checking on the patient. You can go do other things, but keep coming back. If I were you, I'll leave the door open. That way there's always an eye on the patient, right? Keep coming back, check out the patient, how you feel. And then I got all my fiberglass, my gauze, everything ready to go. Doctor's gonna come back, talk to the patient. And sometimes the doctor are gonna come back and put some pressure here. And then you're there with the doctor. And the doctor's gonna tell, okay, wait a minute, are you ready? And that's when you come and do your spleen and do your thing. After that, typically there's a post-reduction x-ray. And once you do that, what I find easy is at this point, I'm gonna release this piece right here. All right? There's two scenarios when it comes to doing this. One is the doctor's gonna be holding it, and you're gonna have to put the spleen on top of the patient's finger. The other scenario is patient's gonna push. He's gonna tell you, okay, women, just go ahead and put the spleen. So once that kind of scenario, this way you're gonna release this right here and release the whole thing. Take this off, and then do your spleen. Can I get some glass? Just open it for me. Remember this piece right here that we folded? Bring it up. All right. I got my gauze here. Oh, should give me another one. My bad. Yeah. Oh, this is too big. Okay, it's fine. All right, you're gonna be holding it here. You're gonna have everything ready. Make sure you open everything. That way, if you're by yourself, make sure everything's open. You have a little table right here. That way, it's only you doing this. So once I got everything open, I'm gonna come over here. I'm just gonna boom, here. When you come over here, there'll be some extra, right? Fold it up. Come over here. Here. All right, I might need another one. Let me have a little one. Once I come here, I'm gonna go over here. I'm going to come right there. Maybe I go one more time. You can always cut this off right here, right? Come over here. Once I come here, I'm gonna fold this back over here. All right, I'm gonna hold it there, take this off. When you take this off, push it from the bottom. It's easy when you push, boom, from the base. This is tight. It's okay, I got it. Nice and gentle, and then I'm gonna come over here, rest it on the patient right there. I'm gonna get my arms. Once I do that, I wanna be safe, right? I wanna do my wheels up. I'm gonna tell the patient that I'm gonna go back up. Oop. I'm gonna have it hold it right there. Maybe she, yeah, that's it. Have it hold it right there. Because remember, it's drying right now, right? Put the legs down. At this point right here, we're gonna put it all the way down. And we're gonna do arm sling right here. The way we do this, I'm gonna ask my patient, stay right there. Typically when I ask the patient, where are you more comfortable? You comfortable like there?
Right there.
Once you find her comfortable position, I'm gonna come right here, here. There, make sure that the elbow is all the way in the back. Once I do that, I'm gonna bring this right here. Find where she's comfortable there. I'm gonna adjust this. Adjust this. I like to do this right here. That way you can see her
What's
fingers.
going on with my finger?
Make sure that circulations, everything's going on right there. And send a message to X-ray and do that post
Reduction?
reduction X-ray. Exactly.
Okay,
That's it.
great.